Today is the last official day to get health insurance under the Affordable Care Act without paying a penalty. But this morning, many visitors to healthcare.gov are finding that the website is down for maintenance. 6 million Americans have signed up after a slow start that was blamed on flaws in that website.
A new Associated Press poll shows only 26% of Americans support the health care law. That is the lowest number since the law was passed 4 years ago. And Obamacare is sure to have an impact on elections this fall. CBS News political director John Dickerson is in Washington. John, good morning.
Good morning, Charlie.
Despite all, if 6 million, perhaps come into 7 million, sign up, does that mean it's working?
Well, it means that it's overcome the obstacles that terrible launch put in front of the administration. That 6 million numbers, you say, approaching 7 million, that was the original target for health. But to know if it's working, we have to learn whether the people who are enrolling are actually paying their bills. Then we have to find out who's enrolling. Are they sick or are they healthy? If they're sicker, then that affects future premiums. And then we have to see where in the country they're signing up. We don't know any of that information yet.
So when will we have it?
Well, we'll start to know in mid-April. We'll start to get some figures out of the government about who signed up, but they're going to be unspecific. We really need to know, again, the geographical location and the sick versus healthy. What to look for there is from insurance companies in the spring and in the summer as they put out their new rates for premiums. Are those prices going to go up more than they would have without this program? That'll give us some indication about what the real truth is about who's signing up and the mix of people doing so.
And John, what about the political impact? Because it seems even the Democrats who are running for re-election are worried that this may hurt their chances of holding on to the Senate.
They're quite worried. If this 7 million target is reached, that is helpful, but it's not great for Democrats because the political problem here is from people who already have insurance, who worried that this program, even if it meets this target, is out of control, that it will cause problems in the existing health care system. And the people who are most animated and angry and ready to go to the polls are people who feel that way or who feel like this entire program is an unnecessary government intrusion. Those people are the motivated people, and these good numbers for Democrats or for the administration aren't going to change the minds of those very motivated people.
Do you think the Obama administration can claim some degree of success because it did make 6 million? They were trying to get to 7 million. Or is it still looked at, well, you didn't reach your goal?
Well, I think they'll certainly claim success no matter what happens. And I think the best news for Democrats is if they can point to a number, and this is a number that doesn't just come from the administration, it comes from the Congressional Budget Office, this 7 million number, and it will at least neutralize the conversation a little bit so that Democrats who are worried about losing the Senate can switch to some other topic. It at least, I don't think this is going to be an issue the Democrats are going to be able to necessarily run on. But if they can neutralize it, then it allows them to raise some other issue that might give them some purchase in this election.
All right, John, thank you. Good to see you.